I'm a neurologist and I have subspecialty in neuromuscular medicine. And as most of us in neuromuscular medicine, the majority of patients we see is with neuropathy. Patients with neuropathy can be divided in two categories: patients with large fiber neuropathies and small fiber neuropathies. And occasionally we see patients with both. The biggest challenge is to identify patients with small fiber neuropathy, because up until recently we had no specific tests for that. For many years we had a problem when nerve conduction study was negative, or the test results were normal, but patient presented with clear neuropathic symptoms. Since the time that we started using SudoScan, it was the feeling of light coming to the dark room. Now we are able to diagnose small fiber neuropathy, including distal neuropathy, including autonomic neuropathy, and all that uncertainty is now starting to go away. Also, we had patients with unexplained pain, and a lot of times those patients were labeled as fibromyalgia patients. In some patients with fibromyalgia, we find strong evidence of small fiber neuropathy, which is another great advantage of this test. I have to say that small fiber neuropathy has always been a hypothetical diagnosis, which was very difficult to confirm with the tests. And now it becomes a legitimate, instrumentally proven diagnosis, and that brings tremendous satisfaction and opens doors for new research. When SudoScan provides evidence of small fiber or autonomic neuropathy, that immediately triggers the laboratory workup, because we all know that neuropathy is always caused by some medical condition. We know that neuropathies can be caused by sarcoidosis, amyloidosis, hepatitis C, cryoglobulinemia, autoimmune conditions, Sjogren disease, for example. So obviously we are obtaining laboratory workup trying to identify those conditions. Those conditions can be asymptomatic, and the only presenting symptom is neuropathy or symptoms of autonomic dysfunction. By discovering those conditions, we basically are frontiers. We are the first physician who gives a diagnosis and initiates appropriate treatment. When we began using SudoScan, we thought that the results should be predictable and consistent with length-dependent distal neuropathy. So we expected the numbers to be abnormal first in the feet. To our surprise, we started seeing some patients in whom abnormal numbers were only in the upper extremities. And it was not one or two occasions, but it consistently repeated in many patients. It gave us another avenue of exploration of the diagnosis, and some of those results correlate very well with cervical radiculopathy, with focal mononeuropathies, and it may even be correlating with spinal cord disorders. And this was a surprise, and this was a very interesting train of thought that we are working on. All neurologists know that nerve conduction study, which is our traditional test, is not the most favorite test because it's kind of painful. When we started using SudoScan, the world turned upside down. The patients love the test. They are very willing to come for the test first time and for follow-up. The test is very simple, it's quick, it only takes 2 minutes, there's no pain involved, and the patients actually are very fascinated with the way how those plates look. And it's very simple and easy to explain to them the results. We show them number, we explain that the numbers should be at certain level, and we explain to them that we are monitoring those numbers in time, and that tells us whether neuropathy is progressing or it's stationary. We try to explain to the patients that neuropathy is of two types, progressive and non-progressive. The patients love it. As a neurologist that sees a lot of patients with neuropathy, I always have a question. Doctor, suppose you diagnose neuropathy, what you going to do? My answer is, we need to find etiology of your neuropathy, and we need to see if neuropathy is progressing in spite of our treatment. It's important because if we have neuropathy that is non-progressive, then the etiology is one-time agent that may not be present anymore. But if neuropathy is progressive, then obviously we are dealing with a condition that continues producing deterioration. Up until recently, we did not have any reliable or available test to monitor progression. Obviously, patients would not agree to repeat nerve conduction study every year. This changed dramatically when we received the SudoScan and started using it. Patients love it. They are willing to do follow-up tests, and now, for the first time, we have a test that can tell us whether neuropathy is getting worse, or whether it's stationary, or whether it's improving. In spite of the common belief that there's no point of diagnosing neuropathy because what can you do? I hear it all the time. In spite of that, we can actually do a lot. We can give them a diagnosis that they were unaware of, and therefore they were not receiving treatment. And I'm talking about early form of diabetes, impaired glucose tolerance, sarcoidosis, Sjogren disease, hepatitis C, cryoglobulinemia, and I'm sure many other conditions, including amyloidosis. So by being able to diagnose those conditions, we are the first physician who actually starts the treatment. What is very important is that as neurologists, we become the first one to diagnose with conditions that were silent, subclinical, or latent. And just to mention, early form of diabetes, Sjogren disease, even autonomic neuropathy of autoimmune nature. Let's say a patient presents with unexplained autonomic dysfunction, multiple syncopal episodes, dry mouth, neurogenic bladder, constipation. The patients went through all kinds of specialists, through GI, urologist, internal medicine. There's no answer. And at this point, if we can provide the evidence of small fiber and autonomic neuropathy, and following workup, blood work, and initiate the treatment, that's the most important satisfaction of using this test. The treatment, of course, is different because conditions of autoimmune nature are treated with immunosuppression. Diabetes will be treated with diet and exercise. Many other neuropathies depend on what we find. We have neuropathies associated with low levels of vitamin B12, low or high levels of vitamin B6, vitamin E, gluten sensitivity neuropathy. And imagine that the patient has unexplained symptoms. We diagnose them with gluten sensitivity, recommend gluten-free diet, and they come back and they get better. I think that with the advent of SudoScan, we opened a new era in the science of neuropathy. I've been working as a neurologist for 30 years, and I've been through all this time when we were told that this is it, we don't have the answer. We have to give the patient a negative answer and say, you know, your tests are normal, I know you're hurt, we don't know what it is. So a lot of patients were sent home without the answer, very unsatisfied. With advent of SudoScan, now we can actually give the answer. And we can open the whole avenue of new research in terms of following up on small fiber neuropathy, finding the treatment, actually answering the question, to the huge area of neurology, which is small fiber and autonomic neuropathy. It's very hard to overstate the importance of this test. I want to thank the company for coming up with this device, being so convenient, so painless, so beautiful, and very helpful.